Jake here. Mental health is a verb, so today's topic is bipolar. Here's my visual that I sketched out. Pause the video if you like and take a look at it. So, what do you need to know about bipolar? Literally, let's start with a name. Bipolar, swinging between two poles of moods. Now, that's mania and depression. Dependent upon the specific type, diagnosis of bipolar, it could be type 1, type 2. It could also be mixed. You may not have mania with the high highs, the euphoria, the agitation. It could be hypomania, so to a lesser degree. And then cycles through depression. Typically, what you'll also see is also periods of quote-unquote normal mood or euthymia. So EUTHYMIA, something like that. Now, I don't see a lot of nursing questions, pre-licensure nursing questions related to is this type 1 or type 2. But that's the general difference, okay? We focus on assessment interventions because that's usually where you see the bulk of your questions. As nurses, we need to know how to assess it, and we need to know what are we going to do. All right? We're action-oriented. How do you assess mania? What does this person look like? So a person in a state of mania can have that euphoria. They could also have agitation. Typically, they have labile emotions. They could be intrusive on others and on yourself, so you may have to remind them of boundaries. Increased motor activity. They may not stop to sleep. Oftentimes, they report trouble with sleeping. Stopping to eat. They may neglect ADLs. They may be dressed very brightly. If a person wears makeup, very particularly bright makeup. Promiscuity, risky behaviors, perhaps charging up credit cards. I think you kind of get the gist here, right? So, with depression, that particular cycle, go back to that depression video. You've already got your A words. You've already got those in your pocket. So, it's the same sort of presentation, the A words that we talked about in the depression video. Now, as far as safety, always think safety with assessment and with interventions. And I'm going like this and like that because I've got two arrows, one pointed up at assessment and the other to intervention. So assessment with, safety related to assessment is those risky behaviors and excessive spending and such like that. So as a nurse advocate, we want to advocate for our patient and perhaps some education and to let them know maybe this is not the time to be making those sorts of expensive choices, that sort of thing. And as far as promiscuity, they may not be using protection. Now, if they're inpatient, some of this behavior is going to be limited, of course, all right? And so in nature, just by the nature of inpatient criteria and them being in a limited setting, we could curtail a lot of this type of behavior. Now, as far as interventions, non-pharmacological, using therapeutic communication, psychoanalysis might be beneficial for someone in that depressed cycle state, but probably not so much someone in a state of mania because in that state of mania with that increased motor activity, they're going to have rapid thoughts, pressured speech, so they may not benefit too well from psychotherapy in a state of mania. As far as intervention go, set limits on behavior, remind them of boundaries, monitoring ADLs. When I said they may not slow down to eat, you may need to consider finger foods. You may see some test questions related to that. High calorie, high protein. They may need something to help them get some rest. Now, as far as pharmacological interventions, your mainstay treatment, and this is where you may see some questions too, lithium. So lithium has it's an old drug. It's been around the block a few times. So this is like a salt in our body. It competes with other sodium receptors in our body. So a test question usually you'll see is related to this person needs adequate intakes of salt, sodium, dietary is what we're talking about, and water. Usually about 1.3 to 3 liters of water a day. Now, with the salt, I want you to think about a couple of scenarios. If you have, say, a cardiovascular patient that's been advised on a low sodium diet, or maybe a chronic dialysis patient, this may not be the drug for them. There are other drugs, and in fact, some of your anticonvulsants, and look at your text resource, but some of your anticonvulsants are also utilized as mood stabilizers. But generally, your test questions are coming from lithium. So we already talked about it has a narrow therapeutic range. Usually your maintenance range is like 0.6 to 1.2 milliequivalents per liter. Now you can, if it's an initiation, it can range a little higher, and that's 1 to 1.5 if they've been if this is their first time on the drug. You're initiating therapy. Now, before they start this medication therapy, you're going to want a baseline of renal function, so a baseline BUN creatinine. For long-term, someone that's on long-term treatment with lithium, they may have risk for goiter and abnormalities in thyroid function. So you may also want to consider a baseline. I want some steak. A baseline thyroid function. What else I want to say about lithium? Side effects. Now, some of these side effects, you guys, resolve over time. GI distress. So, advise your patient education to take this with meds or milk. They may have fine hand tremors. Polyuria. So, you may want to consider, if someone is on a diuretic, that it's a potassium-sparing diuretic. They may have some weight gain. They may have renal toxicity. And again, these are potential, okay? Always consider this potential. And that's why we guide. That's why we ask for the baseline renal function. And we already talked about the risk for goiter, hypothyroid with long-term treatments. They also have risk for bradyarrhythmias, hypotension, and electrolyte imbalance. So lithium carbonate is your mainstay prescription pharmacological treatment. And usually if you see test questions related to the sodium and water intake and also that narrow therapeutic range. So most of your resources will tell you levels greater than 1.5 are considered toxic. So think about that. If a maintenance level, what I mean is someone's established on lithium is 0.6 to 1.2 milliequivalents per liter, and toxicity is considered 1.5, you can see that's only like 0.3 difference. And so people, of course, they would need to be careful. Now, related to that, you may have issues with med non-compliance. And I feel like you can kind of see this. If people do experience, say, euphoria, who wouldn't want to feel euphoric all the time? Although we already talked about some of those other behaviors that may lead to. But there may be issues related to med non-compliance with that particular presentation of potential side effects and the need to remember to take your medications, and of course thinking it's going to take away those highs and put me in a state of quote-unquote euthymia or normal mood. So look out for those questions as well. All right. Thank you guys for tuning in, and I'll see you on the next topic.